Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. Crystal Watson, a senior scholar at the Center for Health Security at the Johns Hopkins Bloomberg School of Public Health. She takes on a whole bunch of listener questions, from the state of contact tracing to whether it's time to shave that beard. Let's listen. Dr. Watson, thanks so much for joining me to answer questions from our listeners at Public Health on Call about the coronavirus pandemic. First question has to do with contact tracing. Why isn't the potential of contact tracing being realized right now in the United States?
It's a great question. I think there are a number of reasons. First of all, we have so much virus circulating in our populations that it's really hard for contact tracing efforts to keep up. So what we really need to do is bring down the number of cases so we can meet that number of cases with the contact tracing capacity that we have. But we also haven't invested uniformly in contact tracing and building our workforce across the country. So there's more work to be done there. So it's kind of a two-sided problem.
Got it. I think I saw some data recently about how many people had been hired.
Yeah, so I was working with NPR, actually, who've done 3 surveys now to look at the contact tracing workforce across the country. So they surveyed the state health departments, and it looks like there are about 30,000 contact tracers working across the country. We've called for about 100,000, so about a third of the way to the level we think that is needed if we get the virus under control, under better control in the country. But this is about the same level that it was 6 weeks ago, so it feels like it is stalled out a little bit. I think health departments are just really busy doing every part of the response that they have responsibility for.
And perhaps if there is more federal funding, it could help with boosting those efforts.
Yeah, I really hope in the next congressional aid package that there will be more support for states and localities to do contact tracing.
Great. Okay, here's some more questions from our listeners. Is it possible that an MMR booster, that's the measles, mumps, rubella vaccine, might give me some protection for COVID-19?
We don't really have any evidence of that. I don't think that there is a reason to think that would be the case, but we do want people, and kids in particular, obviously, to get the MMR vaccine because it's important for preventing those diseases. So it's still very important to have it, but we don't think it protects against COVID.
Got it. Important for measles. Here's a question. What is better, to go to the same grocery store 3 to 4 times a week for 15 to 20 minutes each time, or just one time for an hour?
So I think the most important thing when going to the grocery store is for you to take precautions, to not be within 6 feet of somebody else for more than 15 minutes, just to generally stay away, but also to wear a mask and to wash your hands after you've touched any surfaces. Those are the precautions to take. I think it matters less whether you were there for 15 minutes versus an hour. This isn't a precise number. It's more about the actions and the physical distancing that you take when you're at the grocery store.
So it may be better to go at a time when there are fewer people around.
Absolutely.
Here's a question about whether all the steps being taken for the coronavirus might lead to a lighter than usual flu season this year. So social distancing, masks, for example, have potentially the ability to reduce flu transmission. So do you expect a light flu year?
I think it's a little too early to say how the flu will behave in this country, although we're seeing in the Southern Hemisphere that they are having less transmission, a fewer number of flu cases. So I'm hopeful that that will be the case. Obviously, the steps we're taking to prevent transmission of COVID, of the SARS-CoV-2 virus, also will have an impact on influenza. But I think we've yet to see how much of an impact it will have.
Now, if you live in a household where everyone tested positive for COVID, can the people keep passing it back and forth to one another, or will they just get it one time?
So far, our experience has been that people do not get reinfected, at least within the early days of following COVID-19. So we think that you wouldn't pass it back and forth. Hopefully, immunity will last a long time, but right now we think at least it lasts about 3 months. So that shouldn't happen within your family.
Can a COVID test read negative if it takes too long to process the sample?
So I haven't heard of that. I have heard of, with the antigen test in particular, that if it's not processed within a certain short period of time, that it may actually read positive falsely. So it is important that their process, particularly the antigen test, is processed quickly. But with the PCR test, I haven't heard that.
We want the PCR test to be done quickly so that contact tracing can happen.
Absolutely. And people can make personal decisions about whether to isolate or have their family quarantine.
Great. Is testing positive for the coronavirus the same thing as having COVID?
Yeah, so COVID is the name for the disease, COVID-19. If you test positive, that means that you've been infected with the SARS-CoV-2 virus, but we use them fairly interchangeably. So if you test positive, some people will say you test positive for COVID-19, but yeah, it is the same thing.
A stickler might say you need certain symptoms to be diagnosed with the COVID-19, but they're used interchangeably. Would it make a difference if your mask were wet with water to prevent the virus droplets from entering your nose or mouth?
No, I don't think we have any evidence of that. Your mouth is wet and you still get the droplets in your mouth. I think there's a danger if you get the mask wet that it could harbor other bacteria or other things that might make you sick as well. So I wouldn't do that.
So someone wrote us, I've had 2 antibody tests, one in early May and one in mid-June, that came back positive for COVID-19 antibodies. In order to keep my antibodies active, should I be, quote, less careful, end quote, so to speak?
No, we don't really know enough about immunity right now. It's not a good idea to intentionally try to re-expose yourself. And it's not going to necessarily boost your antibodies if you're re-exposed, especially if you already have the antibodies and they're working for your immune system. So I think I would not try to do that.
Great, and you run the risk of maybe exposing someone else in the process.
Absolutely, yeah.
So question is, I may be invited to a small family gathering, no more than 15 people. If everyone self-quarantines for 14 days prior to the event, would we be able to gather without masks or social distancing?
In a perfect world, if everyone quarantined and you had no exposures, theoretically that would be possible. But I don't think we live in a perfect world, and we don't really know what everyone else in our circle is doing. So my advice is really to take precautions by keeping away, stay 6 feet away, and wearing a mask, especially when you're indoors. But that is a personal decision. You have to take the risks that you feel are necessary for your family. But I would recommend still trying to maintain that physical distancing in particular.
Got it. Here's a question. Can I get tested in a county I do not live in? I am staying with my parents.
Yeah, you should be able to get testing even if you don't live in that location permanently. You will just have to provide contact information for them to get back to you on the results of the test.
Another person writes us, I am a part-time rideshare driver. I take all the recommended precautions, but I wonder if I am playing Russian roulette with the virus. There are increasing number of cases in my metro area. Should I stop driving for now?
I think it really is up to your personal risk tolerance. It depends on whether you think if you have an exposure, whether you are more likely to have severe disease, if you have underlying health conditions, or if you are older in age. You have to decide that for yourself. But I do think you can't control everything in that environment because you don't know who is stepping into your car, what precautions they've been taking. Perhaps you can enforce mask wearing in your car. But I do think you can't make perfectly safe. So if you're uncomfortable with it, then it might be something to think about.
Great. Okay, here's the last question. And it's a long one, but you'll see it has a very specific question at the end. Has there been any empirical data demonstrating that the small viral droplets adhere more easily to male facial hair, such as beards and mustaches, thereby raising the potential risk of infection? For example, droplets getting caught in the beard or mustache and then inhaled. I think this is important because while dining out on restaurant patios, my mask comes down or off like everyone else who is dining out. In short, in light of COVID-19, should I shave my beard off?
That's a great question. I don't think we have any direct evidence that facial hair would trap droplets and viral particles and make it more likely for you to inhale them. But I do think it is a good idea to possibly shave your beard for the purpose of wearing a mask, especially if you're wearing an N95 mask. It's important to get a better fit to prevent those droplets from being inhaled.
Great. Well, thank you so much, Dr. Watson, for joining me again.
Thanks, Josh.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.